Terry, what does success look like in 5 years' time from an LHD perspective?
If we take it from the point that where we started in relation to the consumer and the community, the first thing that I think success looks like is that there is transparency, as Tony I think has referred to, within an LHD, so that the clinicians, the community, the management, the board are very clear about what can be provided, what is being provided, what is available, where it's available, and where people can access services when they need them, and in a timely fashion. The second issue around success is going to be that there is confidence in that community. Let's take an LHD, confidence in that community that the services that are being provided are quality services and that they're safe. And that's a really, really important issue, that level of confidence in the community. At the moment, we've got a way to go, I think, as a society and a community and in every LHD, in getting that level of confidence across our communities. And one of the major reasons for that is that they think it's all secret accountants' business. And one of the issues that this will drive is it's all going to be out there. The first step in that is that there will be an engagement between clinicians, management and the board of the LHD. This will happen with networks as well, so I'll just use LHDs as a shorthand. There'll be a dialogue between them that is based in the fact that every one of them every day gets up to serve the community and provide the best services they can within the resources that are available, but at the same time that people understand where the shortcomings are, where the improvement needs to take place, and what can be provided and what can't, what you got to wait for and what you don't. And the fact that there is a limited pool of resources available to our whole society, and there's a demand that is greater than can be met by that need. And there'll be an honesty and openness about the discussion and dialogue that takes place at all of those levels in relation to what can be met within those resources that are available. I think the other issue is really around when a patient comes to any of our services, they will know that the clinicians and the management and the board are working together in terms of what can be provided. Efficiency is a big issue for everybody. Effectiveness and appropriateness are equally true, but if we talk about the efficiency, LHDs have to run a service. Boards have a governance role that's really, really important, and they need to make sure that those governance situations are in place and they're doing what they need to do and they plan for the services. If they know how they're going to be funded, and if everyone else knows how they're going to be funded, there can be a better dialogue with Medicare locals, with service providers, with the community, with politicians, with the ministry about that. So success 5 years down the track may not be that we have an uncapped system, because everyone recognises we don't, and that we're not going to have. But everyone will be prepared to sit down and say, this is what we've got. We've got confidence that it's quality care, that it's safe when you go in, and that there's a recognition that when it doesn't work, we'll accept that it doesn't and we'll work on doing it, and we're getting value for money. So I think that's what success looks like. There's one other issue which is critically important to this, and in my view, which it won't work unless it happens. If in 5 years' time we are not sitting down with the boards of local health districts, the managements of those services, and the facility and service clinical councils, and working out what we need to do for the next year and the year after and the year after, in the knowledge of the dollars, in the knowledge of the budget, and saying, well, should we be having this service provided in a hospital? Or is it going to be the same outcome, as satisfying to the patient and their family, and less costly if we provide it in a different way? And that's the loop that I think Diane was talking about, that says, okay, we don't need anyone to come and tell us. Let's make the decision to change the mix of that. If we get to that point of trust and working together and understanding and transparency, then we'll solve the problem, even though we won't meet all of the demand and all of the expectations that exist.